have an extra set of sterile gloves. I have my trach care kit and my bottle of sterile water and my vital signs machine. Gonna come in. All right, Mr. Smith, how are you? So we're gonna go ahead and do your trach care for today. All right, we're just going to deep suction your tracheostomy, and then I'll remove that inner cannula, give it a nice good clean, and just replace it. Make sure I get around the wound and any debris I see. Okay, before I start, I'm just going to go ahead and do a nice auscultation of your lungs and an assessment. Can you please tell me your name and your date of birth? Very cool. James Smith, 4567. And of course, you remember my name's Kate because I've been in here many times today working with you already. All right, Mr. Smith. So we're just going to go ahead and auscultate your lungs. Just take some nice deep breaths in and out. Awesome. In and out. In and out. In, out. In, out. In, out. Thank you, Mr. Smith. And of course, throughout that, when I first came in, when I was first talking to him, I was observing his work of breathing, noting for any labored breathing, any concerns there. All right. So mostly I just want to hook you up to this pulse ox machine. If it had been a while since his most recent vital signs, I'd want to go ahead and get a full set, but we're going to go ahead and assume that the CNA just recently got a set and they were all within normal limits. So turn that on, have them hooked up just to the pulse ox throughout the procedure. Come on up to me. I've already got enough back pain. Thank you, sir. And I do want you in a semi-Fowler's position. And as I taught them on the bed, there is a dial. I think I showed everybody that shows you how tall they're sitting. All right. So I'm going to get my sterile area set up for you, sir, and then we'll get started. Do you have any questions? All right. James, I apologize. I'm going to set that right there on your bed. Thank you. Okay. I'm just going to place a set of sterile gloves on. I want to make sure we keep you very clean. Don't want to introduce any unknown bacteria. Pardon me for using your lap, sir.
You want me to pour water?
Hey, CNA, I need a favor. Could you pour water into there for me, please?
Pour in the trash.
Yep, but I really need water in there.
No,
like
I
actually
really
do
need
it.
water in there, please.
What? Like take it off.
Take the lid off, please.
Oh, okay.
pour.
okay.
You gotta pour in the trash
Just
first.
that one.
Okay,
Oh.
one more.
That's great.
Alright.
Thank you.
What about the other one?
Nope, that's all I need for right now. Okay. So this is all sterile, so I can touch this with both hands. I'm going to go ahead and get these set up so when I'm POW I can use these for my second part of the procedure. Just in case there's any splash, I'm just going to go ahead and place this on your belly. Okay, so this hand's no longer sterile, it's just clean. So with that, I'm going to grab right here. Go ahead and grab my suction tubing, place it on here. Turn on my suction. Pre-oxygenate. Monitor. Alright, Mr. Smith. So I'm just going to let you oxygenate for just a moment, and then we'll kind of get started. Alright. So I'm just going to remove your T-piece to the side, okay, so I can suction. Awesome. Thank you, sir. Alright, I'm going to pass the catheter down until I meet resistance. Pull back about 1 centimeter, and then 1, 2, 3, 4, till it removes. Alright, we'll wait a minute. Oh, it looks like we really took some oxygen out of you there, sir. I'm going to place that T-piece back on top. Alright, doing okay? Awesome. Still feel like you got some in there? Yeah, I felt like so too. So let's try that one more time. It's been a minute. So we'll set that off to the side again. I've already cleaned it in my sterile water. So I'll proceed again. In we go. Pull back a 1/2 inch. And it's 1, 2, 3, 4. It should take about 10 seconds to remove your catheter all the way. So that's the speed I'm working at. Wait another minute before we proceed again. Your oxygen seems to be holding, but just to make sure I've kind of got you nice and oxygenated, no reason not to put that back on. See them Tar Heels yesterday. Necessary win, wasn't it? Yes, sir. Might even get into the NCAA now. Yeah, we got Duke on Saturday. I'm pretty nervous about it as well. Alright, been a minute, sir. We're going to go ahead and pass that catheter one more time. Pull back a 1/2 inch, and 1, 2, 3, 4. Oh, good. I did not get all. Seems like we cleared you out there, sir. Not as many goobers on that last retrieval. So I'm just going to go ahead and clean out my catheter now. And we are done with the suctioning portion. And I'm going to get rid of these gloves so they can all be dirty now. And again, we'll go ahead and take the catheter, dispose it into the glove there. And be done with that. I'll be smart this time and pour my water first. If that had happened in real life and I couldn't get anyone, I would just have to go fetch a new, trash it all, start over. It happens. Alright, so we're going to grab these sterile gloves carefully off of my sterile field. There we go, both hands. You go ahead and moisten these while the water is still sterile. Everything nearby. Again, this hand's going to become dirty, so I'm just going to slip that off to the side. Again, we've been pre-oxygenating him. I never turn the oxygen down. I'll go ahead and pull this old dressing out. Yeah.
Yeah.
I'm going to just slip this over your head, Mr. Smith. All right, thank you, sir. And pull out my inner cannula and place it in the water. From there, I'll grab my brush, slide through the top. It has goobs on it, so it's okay to dip it back in the water. Slide through there. Kind of fold these in half just to increase their surface area. Through the top, and again, I like to kind of get into here. It's a little wider there, so you got to use a little extra circulation. And through the bottom. Alright, and just like that, we've cleaned our inner cannula. Maybe rinse off any debris that may be held on. Then you want to slip it in, and I can use either hand now because I'm to the outside. And slip it in just in the way you think that, how the trachea kind of goes there. And it just clips right back in, and I know it's nice and stable. Now I take my pre-moistened Q-tips. I take one pass here along the bottom. And at this point we're mostly clean because we're on the outer side of the skin. We're not way down in that trachea. It's a little harder when their neck is, you might have to remove the pillow. Yeah. Because now I can really kind of bend this down a little more. The top side of it, maybe use a moist piece of gauze. Put even a little more around the wound out here. Trying to be as gentle as I can, but understanding that this is a healed wound, kind of like an ostomy on a colostomy. Or a stoma on a colostomy, I should say. Alright. So I've managed to get clean all the way around. I'm going to go ahead and replace my dressing. It can be done before or after the ties. Depends usually on how dirty it is. If I want to put clean ties on first, I may wait till after. It's helpful to use the Q-tip to push it up under there. It's a nice little tool you can kind of utilize, especially when they're real tight or sutured down still. Then I never ever want to take the old ties off until my new ties are on. For this, I like to use little pipe cleaners, give it a little bend at the end to aid my quest. So that it pokes right through it. I'm not sterile anymore at this point, so I'm just working with these ties. Sterility needs to be maintained when I'm working with that inner cannula and the suction because I'm inside their bodies, right? Now I'm just messing with their parts, their equipment. I'm trying to be as gentle as I can. I don't want to be pulling on this. I don't want to cause them any harm. Gonna lift up your head here, sir, wrap around. I'm always watching the oxygenation as the O2 sats. It would of course alarm me if it was to dip. What would I do if it dipped?
If what dipped?
What are you doing?
If you weren't talking, you might have heard me.
I wasn't speaking.
It was me. I was asking something.
Just put it on.
Yeah, I would just replace the T. Take a break and replace the T piece. That's gonna be on video. I scolded you. Look at that.
Nothing new.
Okay. Got the other side. And again, this doesn't want it to be like super tight. You don't want to choke them or anything like that. I'm sorry, Mr. Smith. I apologize for reaching over you like this. But not too loose either. That ended up a little loose, so we'll readjust. And I much prefer those Velcro ones like was on him when we started. They're much easier to work with. Okay. Now remembering what's removed, there we go. Old ties off. Alright, and then double check, of course, that your new ties are still in place. I'm worried they're a little loose, so I'm just going to readjust. Alright. Okay, Mr. Smith, just going to replace your T-piece. Oxygen hasn't been alarming or anything, so I feel good about his oxygen level. I'm going to just give him a little bit of that oxygen still running from before, so while I just place his pillow, get him all set, and letting that just run for just a minute. Get him a little more comfortable, and I'll go ahead and turn that back down to its original setting. Alright, Mr. Smith, I'm just going to take a listen one more time. Just to make sure we're all good. And I'm going to get one more set of vital signs as well. Okay? Alright, oops. I've got a little piece there. Sorry about that, sir. Just take some nice deep breaths in and out. Awesome. Okay, a couple more. Thank you. Halfway there. Alright, two more, sir, two more. Excellent. Alright, thank you, sir. I'm just going to grab a quick set of vital signs just to make sure everything maintains. So put the cuff around him, get a full set of vital signs at this point, because we just want to make sure nothing abnormal happened during the procedure. Assuming his vital signs are all good, lungs are improved. They may not sound clear because I do have a trach. And imagine you're only suctioning right to about here with that catheter. So they may still sound a little coarse at the bottom, but you're just looking for signs of improvement and that they're not breathing, because you don't want to hear the as they try to breathe, because that just means the tube itself has a little bit of sputum going on there. There it is. Any questions?
Mm-hmm.